Good morning and welcome to FYI, a community affairs program of this station. I'm Mark Weinstein, Executive Director of Public Relations at Cedarville University, your host for today's program. Today in the program, I have 4 leaders who are committed to improving healthcare, educating future healthcare professionals, or finding solutions to our current health-related issues in Ohio. This includes the topics of the opioid crisis, healthcare communication, and prescription drug pricing that we all see or experience in our daily lives. Joining me today in studio is Marty Larson, President and Chief Executive Officer of Ascend Innovations, a digital health firm that specializes in data science, design, and research. And I must add, he is a Cedarville University graduate. In Southwest Ohio, Marty has led the charge in reversing the opioid crisis that has gripped our state. Next to Marty is James Paat, President and Chief Executive Officer of Insight Health Systems based in Columbus, Ohio. James has spent the past 25 years working with Global 1,000 companies, government agencies, and healthcare providers to identify, build, and implement data management strategies. In 2018, he was listed among the top 20 leaders in the healthcare industry. James and Insight Health Systems just signed a contract, incidentally, with the Navajo Nation in Arizona to modernize the Navajo Nation and develop initiatives to address the opioid crisis within the Indian health system. And that is a division of the United States Public Health Service, and we'll get to talk about that more in the program. Also in studio today is Dr. Jon Sprague, the Ohio Bureau of Criminal Investigation's eminent scholar and the director of the Ohio Attorney General's Center for the Future of Forensic Sciences at Bowling Green State University. Dr. Sprague has served as the University Director of Academic Research and head of the Pharmaceutical Sciences for the College of Pharmacy at Ferris State University. He's also served in leadership roles in pharmacology and pharmacy at Ohio Northern University, Virginia Tech University, and Purdue University, where he received his PhD in pharmacology and toxicology. Dr. Sprague was also instrumental in writing the synthetic drug laws for the state of Ohio. These laws focused on the synthetic cathinones, cannabinoids, and opioids. And our final guest is Dr. Mark Sweeney, the founding dean of the School of Pharmacy at Cedarville University. Dr. Sweeney has served in leadership roles at the University of Findlay, in the Findlay College of Pharmacy, Ohio Northern University's Rabb College of Pharmacy, and he's taught both medical students and family medicine residents as a clinical family member at Ohio University College of Osteopathic Medicine. Dr. Sweeney's expertise lies in community and hospital pharmacy, ambulatory care, home care, hospice, pain management, and long-term care. Thank you each for joining me for this important discussion today. Thank you.
Thank you for having us.
Good to have you. So, after those lengthy introductions, if you're just joining us, you're listening to FYI, a community affairs program of this station. I'm Mark Weinstein, the host of the program, and today we're going to dive into some really important stuff related to healthcare, and with these 4 guests in the studio. So let's start, because time is of the essence. Let's dive right into the first an interesting point of view that I'd like to get about where we are in the current opioid crisis. And I want to focus my question to Dr. Sprague. Where are we as a state in this opioid crisis?
When you look at the state of Ohio, if you just go back to 2010, when we really started to see the opioid crisis hitting the state, or we really started to notice it hitting the state, the issue we had was mainly prescription opioids. Okay. And we started to see a shift downward in the prescription opioids. Then we went to heroin for a while, and now it's really fentanyl and the fentanyl analogs. And these fentanyl analogs that are being made, mainly in China and being shipped to the United States, were made in a way to try to circumvent the laws. And so what we don't know with these compounds is their relative potency. And unfortunately, they tend to be much more potent than even fentanyl. And as a result, we still see overdoses happening within the state of Ohio. One of the big issues we have right now is the resurgence of carfentanil. Carfentanil we started to see a decline in towards the end of 2018, but in the last 6 months, and in fact the last 2 weeks, we've started to see more carfentanil overdoses. In fact, Memorial Day weekend in Cuyahoga County, there were 8 overdoses associated with carfentanil. I believe there was almost 7 in Hamilton County from the same thing. And so we've made some major progress when it comes from the healthcare perspective, reducing the number of opioid prescription units that are dispensed to patients. but at the same time, we're still seeing this tremendous increase in the number of deaths associated with opioids.
Okay, so it sounds, and it is very serious. I remember watching national news and hearing that Montgomery County is the epicenter of the opioid crisis. Whether that's fair or not, maybe you would have an opinion on it, but where is this crisis heading right now?
When you look at Montgomery County, we see a lot of attention given to Montgomery County.
Okay.
When we looked at what was called the farm-to-arm supply chain, and literally it was what was happening with heroin is that morphine was being derived from the opium poppy, being converted right in the field to heroin and being shipped at that point across from Mexico and landing in the Midwest in the Dayton area and being shipped up and down 75 and across 70. And so it put Montgomery County right at the heart. So that's a true statement. Where are we headed? Based on an article just released last week from the Journal of American Medical Association, they're actually predicting that we're going to grow to 82,000 opioid deaths a year by 2025. Which is a 72% growth from where we are now. So what they're predicting is that the overdose rate is going to continue to climb. Now our goal is, can we make sure that it doesn't reach what they're predicting?
Yeah, that's a daunting task. And as someone who's worked in higher education for 30 years or so, I want to believe education can be part of the solution, and hopefully it will be part of the solution. So I want to move to the educator on the panel, Dr. Mark Sweeney. There's a national trend taking place right now where pharmacy schools are getting involved in the opioid crisis. I know you, as the dean of the School of Pharmacy at Cedarville, has played a role there. Why is this taking place, and what are some ways Cedarville University School of Pharmacy has been involved in helping to reverse the opioid crisis in Ohio?
So, yes, across the United States, there are a lot of initiatives that colleges of pharmacy are taking. And let's face it, when you talk about opioids and pain management, that touches the profession of pharmacy. There's community pharmacies in every community across the United States. So our students and our alums are actually talking with people who are facing some of these challenges. So the colleges of pharmacy, recognizing that education is a key factor, not only education of our students, but education of our alumni and education of prescribers. And so I'm very pleased to announce that a lot of colleges have been very successful in launching initiatives, some of which are just educating the public about naloxone. In some cases, it's educating lobbyists or educating legislators about what maybe needs to happen at that level or at the state level. And in some cases, it's education geared towards to youth, middle school students, high school students about the dangers and concerns. Not a whole lot different than if we go back a few decades in dealing with the problems with smoking and cigarette use, utilizing education to have some impact there. In terms of the School of Pharmacy at Cedarville, we have taken on some research initiatives and pilot programs to basically address some of those concerns. So we do have students who are educating high school and middle school students. We do have some research going on as alternative methods to manage pain in some clinics using different approaches. We've also taken on the initiative to educate prescribers on pain management guidelines, but we're also headed down the path of implementing kind of new and innovative approaches using some of the evolving technology that's existing. And I'll just mention that one of the big challenges in our healthcare system is a segmented system. We have a problem because we have all this information and data all separated out, but when we're trying to take care of people, we need to have all that information collectively together to be able to best manage. And that's some of the things that we're trying to move towards.
So this move to help reverse the opioid crisis here in Montgomery County, Southwest Ohio specifically, what's worked that you've seen from the work of your students? Have you seen anything tangibly that really has made a difference?
We've had a lot of participation. One thing I didn't mention was some of the drug take-back programs that we do. And,
right.
We are collecting medications in homes and getting opioids out of the homes through those initiatives. I think that is working from the standpoint of at least eliminating some of the the risk or temptation on the part of children or grandchildren getting a hold of opioids. I think that's effective. But we're still waiting. The verdict's out on some of these other initiatives to see if they're really having an impact. I mean, we have theoretical and philosophical beliefs that some of these will have an impact, but some of the data that we're collecting, we won't necessarily see the impact for a while.
How important, you mentioned community pharmacies. How important are community pharmacies in relation to the big chains? Is that where a lot of good work is being done?
Well, I equate the local community pharmacy, whether it's owned by a chain or not, it's really about the person, the pharmacist in those pharmacies. And as long as pharmacists are equipped to be able to educate and to empower and to resource people, I think that's the real key. Okay. And often it's not necessarily the individual person that has the problem as much as a caregiver, a parent, or a loved one. And that's where I think that resource needs to be for those individuals.
Okay, good insight. If you're just joining us, you're listening to FYI, a community affairs program of this station. I'm Mark Weinstein, your host, and today I'm talking with 4 experts in healthcare, and we're addressing several key topics facing our state. I want to transition away from for a moment away from higher education and its role, and turn to Marty Larson, President and Chief Executive Officer of Ascend Innovations in Dayton. Marty has led the fight against the opioid crisis in Southwest Ohio, and perhaps more than anyone in Ohio. So thank you for that. Marty, with the national media labeling Montgomery County as an epicenter of the opioid crisis in the United States, I asked John, and I asked him if that's a fair label. I want to get your assessment. It probably is, but I want to get your assessment on that. But also, what initiatives have you taken to stem the crisis?
Well, Mark, you're correct. The media did label us the epicenter. It's not anything that we really strive to be, obviously. Right. And when it happened, it was kind of a wake-up moment for us in many ways. Even though we saw the trends going up and understood that deaths were happening on a rapid basis, we saw the need, we saw the problem, and we did start addressing it. And so the Jeff Cooper, who is the Montgomery County Public Health Commissioner, and Helen Kelly Jones, the Adamus Board Director, came together and they formed a committee called the Community Overdose Action Team. And there have been a lot of work going on for some time. We had 3 hospital systems, we had 4 coalitions, we had 30 different organizations, faith-based and not. And so it was an effort that was being done, but I think even as Mark said, it was disparate. They weren't coming together, we weren't working together. And when Jeff and Helen came together and said, we need to look at this as an epidemic and attack it like they would an epidemic, that's when they realized, having this community overdose action team would need to be put together. So now we have over 200 individuals participating in the team, 100 plus organizations. And I participate in a couple different organizations within it. There's a backbone branch, which basically sets the tone. And the goal was to reduce the number of deaths. That was it. Yeah. And obviously we needed to. But there's several other branches. There's an opioid prescription branch, there's a prevention branch, there's a treatment branch. And so within the 8 branches, you've got firefighters, you've got EMS, all these different organizations coming together to address the problem. Mark was talking about education, and even in the prescription world, we held a 2-day seminar last year, and it was well attended by physicians because they needed to know. And oftentimes, if you were to talk to a physician, a dentist, they're aware of the problem, but they may not be aware of where it's starting. So when we look at Montgomery County, when we look at what we've done, has the COPE been effective? Then when you look at ER visits, when you look at calls to legal calls or officers going to ODs, or the number of noxicillin being administered, all of those have been reduced by 50%.
Over what period of time?
Over a year. So from 2017 to 2018. And bigger than that, or even more important than that, is the number of deaths went down 48%.
That's fabulous.
So when I evaluate, what I'm doing in the community, I figure if I'm part of saving one life, that's my job's done.
Right.
To save even 200 plus lives or reduce it by 200 plus lives, it's very impactful.
And you're not ready to stop either.
And we are not ready to stop. No longer are we considered the epicenter of the opioid overdose, but we want to consider ourselves the epicenter for treatment and recovery. We've had several communities come to us, Minnesota, those communities in Dayton, looking to what we've done as a community. I have not seen another community come together as in a collaborative manner and address it like we have in Dayton.
Well, you know, I'm going to go off script and go off message a little bit, but you know, when you talk about coming together, if for those listening, living in the Dayton area right now, hear this program, you know, you saw just over the Memorial Day weekend how Dayton has come together, you know, helping others in the tornado situation. That's what you're seeing in the opioid crisis, where key leaders and organizations are really melding together for a common cause.
Absolutely.
That's fabulous.
Yes.
How has technology played a role in this?
You know,
it's
interesting that you ask. I went back to even when Dr. Sprague was talking in 2010 when the opioid issue, the prescription drugs, it was coming on. I was working with a doctor named Dr. Huizinga, and he was taking care of a patient and was coming into the ER for medication for opioids, and he did not. He took care of the patient but said, I'm not going to do any prescriptions for you. 2 days later, she came in. He saw her. She was there, and he went to check on her. Well, she had died of an overdose. And so Dr. Huizinga said, I've got to do something about this. So what he did is, data is powerful, right? And so the data that the Ohio Board of Pharmacy has with all the medications that are being prescribed from the opioids, he was able to develop an algorithm that basically gives a person a score, something like your credit score. And so if you're under 200 and you go up to the ER, you can get to have a pain shot or whatever is fine. But if you get above 500, they're going to start asking questions. So that was my real first exposure to what technology and data can do. Recently, we've worked with the Adamus board. We developed an app called Get Help Now, and just like it sounds, it means Get Help Now. And so within it, you download the app, and if you're in a crisis mode, you hit urgent needs, and it takes you to the crisis care center at Samaritan Behavioral Health. It gives you directions. It gives you all the information you need how to get there. If you're a family member and you want to know what to do, you download the app and say, I've got a family member that I know needs help. I can look up treatment organizations. I can look up where they're located. I can see what payment methods they take. And so the app has been very effective. It also gives other services, finding employment or food, housing. And so it's been, again, if I'm able to get one life because of moving forward, it's been encouraging. The other thing we've done is, again, using data, we're able to provide the Adamus board an alert when a patient ODs. So they go to the ER as an overdose patient. We get an alert. We filtered everything that comes in from that, and we just look at the overdoses. We compare it to the list of patients that Adamus has with all their clinics, and then we send it to Adamus, and then they are able to follow up on that patient. And the sooner they can follow up on that patient that has OD'd, obviously the better outcomes. And so when you look at technologies, there's just I think we're just skimming the surface right now. Yeah. There's so many other opportunities out there, and I believe that it will happen.
Well, I thank you for your leadership here in the Miami Valley. All you guys, I appreciate your leadership. I need to turn to James. He's been sitting here and enjoying the conversation, but I think it's time to bring him into the conversation. James, you're the CEO of Insight Health, and your organization is not only looking at the problem from a state perspective, but you're also looking at it nationally.
Correct.
What role has your company experienced in this battle of the opioid crisis?
So number one, obviously, the crisis is a very serious one, and it's very complex because it impacts everyone, right? The young and the old, the rich and the poor. And data, as we mentioned, is the key. And what Insight's goal is, how do you make data into action, right? Because we really focus on three critical areas. Number one is early identification. So identifying when individuals that are introduced to opioids, for whatever the reason is, what is a risk? What is the risk that it's going to become more serious? Yeah. So using data to identify the risk to the individuals, but then to mobilize the community and the right resources to either help prevent addiction or help those who are addicted to get proper treatment and recovery. And with that, again, it's not a simple solution, right? As Mark mentioned, there's a lot of approaches around helping the epidemic, right? Whether it's in education or in helping to consult with better prescription habits or working with alternative ways to manage pain rather than taking it. The challenge is how do you organize and coordinate so that the individual patient, which is, each individual's perspective, their journey is very unique. So being able to make it a personalized journey, being able to understand, what are the whole person risks for this individual. They may have can't come in because they had an injury to their shoulder, but if they don't have, a whole person perspective of support from the family to the community to the church to public services, then again, it's very hard to impact the outcomes of that individual. So a big thing with Insight is, it's around being able to take data on an individual, but mobilize that data to all aspects of the community so that individual can get personalized attention.
Okay.
And that's a big part of what Insight's doing. The other part of that now is that, again, there's multiple great approaches about how to improve on the condition. And what Insight's doing is we're able to partner with these different approaches, the education, and we're able to bring that into our system to identify what is truly effective in reducing the risk. Yeah. Okay, so we've got, again, using data to help analyze populations and identify, okay, for this group of patients that were addicted to opioids, what has proven successful for them to help manage their condition? And what can we learn from that individual that has been successful? And then how can we take those key learnings and apply it ongoing, right? So I think that there's a lot of approaches and there's a lot of technologies and there's a lot of approaches coming, but you need to be able to take that, you need to be able to vet it, you need to be able to see what's effective and not effective, and then you need to learn from that system. And again, we didn't get to this point very quickly, and we're not going to get out of the problem very quickly either. It's got to be an evolutionary process that everyone has to revolve around data and resources and being able to use that data to say, this is working, or we have a gap in these kind of resources. So it's all about data-driven, personalized attention.
So when I introduced you at the beginning of the program, I mentioned about this Navajo Nation project you're working on. Mm-hmm. Did your experiences here in Ohio, did that drive that, or is there something from the Navajo Nation work that you're doing that you can bring back to Ohio to help us here?
So again, I think that it's the same set of problems in every industry, in every area. Okay, so what we're talking about here in Ohio is absolutely relevant every place else. And again, I travel nonstop, working with every organization from the Indian nations to the federally qualified health centers to large health systems to large insurance plans to rural healthcare initiatives. And the challenges are the same. When you take a population, depending on where they are, they may have unique challenges, but guarantee that there's a subset of every population that has issues with diabetes. There's a subset of the population that have issues with cancer. There's a subset of the population that have issues with opioid crisis. So I think part of this is being able to go into it to quickly understand it. There's absolutely lessons that can be learned. And I think that this is a great forum that other states that we're interacting with can absolutely learn from. And being able to really initiate these cross-boundary discussions, because we're all trying to solve the same problem. Right, and rather than going into these efforts where everyone's trying to recreate the wheel, we want to take the synergy from the individual efforts and bring it together so that we can improve faster. And that's some of the neat things. Again, working in Arizona with some of the Indian nations is that, traditionally, there's been a lot of siloed approaches to doing things within the four walls or within the organization. And I think when you're talking about a modern healthcare system, it's about the patient and breaking down the boundaries, right? So it's about a healthcare system without walls. Mm-hmm. And if the individual patient at risk needs help from a faith-based perspective, we need to bring it there. If they need help from a social service or community service perspective, we need to triage it there. If they need help from a clinical perspective, where can that individual get the right clinical care, whether it's being referred to the right organization or whether it's in-home or whether it's near home, right? Being able to triage that. Technology is prevalent there. So there's a lot of lessons that can be learned. And every organization has the same problems. And I think the goal here is to kind of learn from it and organize it and coordinate so that synergies can be realized.
Can I add a comment there? So you talk about a healthcare system without walls. What's interesting is I've heard certain companies market themselves that way, but then they implement a model that basically just has virtual walls. And it's so you actively engage someone remotely, but you still are operating in the same silo that you once did. So the idea of working across organizations and cross health systems is a really important facet to that. And then the other comment I was going to make was I really like that you talked about the personal journey of the individual. This isn't not a group of people, but it's actual each individual person, which is, I think, a very key factor to being successful with this.
Absolutely right.
What I want to do, in a moment, I want to ask all you guys this question, and you can comment. But what I'm interested in knowing is what aspect of your work, because we're all working, everyone around this table is working for the same thing, to make people safe, keep people alive, and to end all these addictions. So what I'm interested in knowing is, from your perspective, what most encourages you today of what you see in your fight against opioids or addictions? Is it the role of education? Is it the role of technology? Is it the melding of people and silos being broken down? I'm really curious, what gets you most excited and gives you the most reason for optimism that this can be corrected and reversed and even ended?
I think you just nailed it, though. What gives me the most optimism is all those things are now happening.
Okay.
And that we're starting to see different facets working together that hadn't worked together before. The silos that you talk about were there. I listened to James and Marty and talking about that community effort that's there. That's what we're starting to see statewide. How do we get community efforts to move in this direction? So I think all the components that you outlined there are what get me excited, because we're starting to see that.
What do others think? You all agree with that?
I absolutely agree. Yeah.
I'd go on to say, breaking down the barriers, but for me, because I've been working in the field with Adamus since about 2010, 11, and we kept talking about data and sharing the data and breaking down those barriers, because we've all seen the silos. You've got the justice system had their silo, you've got the hospitals had their silo. And those silos have broken down, so now at Ascend, we've got the full compendium of data to start making decisions, to start following that patient from how many times they've hit the ER, how many times they've hit the justice system, and looking at that patient as a whole instead of just one silo. That encourages me, because I know we are moving in the right direction.
So we're moving in the right direction. I'm interested, I'm going to go back to Jon, from a state level. What initiatives is the state of Ohio looking at right now?
I think the big one that's easy to see and everyone's heard about is the Recovery Ohio, which started, within the first few minutes of DeWine taking office. The Recovery Ohio was implemented. It's initiated their initial response or initial report in March. It outlined 8 different steps that we need to be looking at. It includes many of the aspects that we're talking about today: education, naloxone, Narcan type studies, and it outlines where the committee is going to focus its attention, the community-based efforts that need to be there, the spiritual piece that needs to be there. So they outline that piece. I look at what the Attorney General's office is doing, who I work closely with, and they're starting to move towards a model that really has a focus on science and how you can use science to move towards prevention methods. So those are all steps that the state are making, but I think it plays off of everything that's been said in this room right now.
Has there, I'm just curious, you may not be able to even answer this because this is a radio program, but how much impact has the new DeWine administration had a role in this? Because Governor DeWine, if you don't know, if you're listening, he's from the Cedarville, Ohio area, so he's one of ours. So has he stepped up and made this even more important?
Oh, absolutely. If you look at the fact that he implemented Recovery Ohio from his house the night that he was, took office, it tells you his focus and dedication. I think this focus and dedication, when the next budget is released, you'll see that the dedication is there. And so I think we're going to continue to make progress. It's a top priority for this governor.
It is, and even him coming to Dayton soon after the inauguration to say, what are you guys doing in Dayton?
Right.
Why is it working so well? And then he went around the rest of the state and he's collecting that data, and that's, I'm sure he's making plans from that. So from my perspective, what I've seen with Governor DeWine, it's very encouraging. I know there's funding, they're changing the way the leadership is looking at it, and so it's encouraging.
That's great. Mark, John, or James, any parting thoughts?
So I'll mention that I think it's really great, the community efforts. I think when you look at the whole problem, I mean, I always parallel it to an interstate. There's lots of on ramps and lots of off ramps, and none of us can manage all of the on ramps individually, right? So it takes a community effort to do this, and so some of the initiatives that we're focused on are more preventative in nature, educational in nature, but hopefully having a long-term impact. Whereas some of the initiatives that Marty talks about is very much recovery and treatment oriented, which is a different place, but all needed. So I want to make sure that our listeners recognize this is a complex problem. It's not something that has a simple solution. It's going to be a multitude of initiatives that actually address this.
But we have the right people in place to lead this initiative to make this issue hopefully go away. Would you all agree?
Is it going to go away, or is it just going to? Or can we minimize it? Can we minimize it? Can we manage it?
Yep.
Yeah, that's probably more accurate.
And that's what I would say. Is I don't think I don't think it's ever going to go away. It's been something addiction's been around for.
When you look at the opioid crisis, it really started, I mean, you look at the Eber's papyrus, right? They had the opium poppy with the symbol of joy beside it. If you look at the opium wars that we had, this is not a new problem. It's an old problem that's now reached a new height. And so we got to look at how we manage this in general. I think part of the educational piece is, and I know this is part of Recovery Ohio, but it's not only educating grade schoolers starting young, but it goes all the way to med school. I mean, you look at the fact that with the opioid crisis in general and overprescribing, you look back to when this all started, you'd really have to look and say, how much education did a physician, did a pharmacist have to understand the neurobiology of addiction when this was all going on? It was very, very limited. And so because of that, it contributed to the issues that we had, that the education that they were obtaining at that time did not have a focus on.
And a classic example for that one is that doctor from Columbus who's been charged with 25 counts of murder for overprescribing to patients. So if you didn't think it was real, that would really slap you in the face and prove the severity of this situation.
Absolutely.
So that's today's program, which came to you live from the Cedarville University Newsroom. I want to thank my guests, Marty Larson, President and CEO of Ascend Innovations, James Paat, President and CEO of Insight Health Systems, Dr. Jon Sprague, eminent scholar for the Ohio Bureau of Criminal Investigations, and Dr. Mark Sweeney, Dean of the School of Pharmacy at Cedarville University. I also want to thank you, the listener, for spending the past several minutes with us. Please join me next month when I will have guests who will discuss today's current events from a biblical perspective. As you know, Cedarville University teaches all of its academic programs from a biblical worldview, whether it's in pharmacy, cybersecurity, engineering, biblical studies, or nursing. Cedarville University is located in Southwest Ohio between Columbus and Dayton and has a student enrollment of 4,200 students. That's at the undergraduate, graduate, and online levels. I encourage you to check out Cedarville University by visiting cedarville.edu. That's cedarville.edu. Thanks for listening. Have a blessed day.